Technology has come a long way in all aspects of life. Medicine is no different. Robotic-assisted joint replacement is on the horizon. I'm Dr. Travis Rump, Salina Regional Orthopedic and Sports Medicine Clinic, and I'm here today to talk to you about robotic-assisted joint replacement.
Well, Dr. Rump, you've been in my studio. I'm in your studio, so to speak, your surgical suite. We're going to be talking about this robot here. Why don't you tell us about robotic-assisted surgery?
Well, basically, technology is advancing in all aspects of life. The cars that we drive, the computers we use are far better than those that we used even 5 years ago, 10 years ago. So there's no reason to think we can't make improvements to the way we do joint replacement by using technology, which would be robotic-assisted technology. And luckily here at Salina Regional, we have the benefit of doing that. So basically, any patient that's candidate in our clinic for a joint replacement is a candidate for a robotic-assisted joint replacement. What we do is we have the patient get a preoperative CT scan, and we are able to look at the patient's anatomy and make our bone cuts where we want our implants to be. You can see these different images here where we've taken bone away from the patient and we minimize the amount of bone that's taken away, which is very beneficial. And we're able to change the patient's implant to where it's going to go by millimeters, and that's very, very precise. And what that does is it allows us to tension the patient's ligaments so we can get stability throughout range of motion. The reason this is beneficial is because of the precision and accuracy that it allows us. It allows us to make very, very minute corrections in alignment and positioning, and that typically translates into a very stable product, which is why we're very excited about this. So from there, once we are satisfied with where our implant positioning is, we make that decision ahead of time. Then we come over and we have the robotic arm. So the robotic arm comes into the side of the table, and we then register the robotic arm to the patient's anatomy and to the patient laying on the table, and we actually use the robotic arm to make the cuts of bone in a very accurate fashion. And that allows us to have these very accurately performed knee replacements and hip replacements. So then we implant the total knee from there, and we've just been very happy with our results from there.
Okay, and it's important to know you're doing the surgery, or Dr. Hawks, or you are doing the surgery. The robot is there to set the limits. Is that a good?
That is accurate, yes. So we are still very much in control of everything. The robot is simply allowing us to make things very precise.
Well, thank you so much for being on the show and explaining the robot to us. And thank you for watching. For more information, you may visit SalinaRegionalOrthopedicClinic.com and like Salina Regional Health Center on Facebook. Follow us on Twitter and Instagram.